This year's Mother's Day, on May 9th, like many public holidays, went unnoticed, plausibly as a result of the coronavirus pandemic that engulfed the world. 8 months later, and with the discovery of the vaccine, life is creeping back to normality. But next year's Mother's Day, if the odds are not stacked against this girl we shall call Sarah, only aged 14, she could be a mother. On a calm Wednesday mid-morning, as the sun rays leisurely pierced through the clouds last month, we stumbled upon her at Bugobero Health Center 4 in Nakupa village in Manafwa district. At 5 months pregnant, she was attending her first antenatal care in company of a 16-year-old pregnant colleague. Out of fear of being ostracized, the duo lied about their ages on the medical forms. And since carrying any form of identification is not a requirement, ordinarily nurses document the records as they are, but in the grand scheme of things, this obscures the capturing of statistics of teenage pregnancies in the country. But this did not douse our curiosity. After imploring her for several hours, we embarked on the odious task of tracing her family. When we eventually did, her parents told us they had last seen her in July. The mother said she was lured from home by a female family friend, an auntie, to meet a recently circumcised boy as part of the Gishu Imbalu culture, and was to serve a strange purpose to prove if the boy's wounds had healed. The father said he had been holed up in Tororo where he works when the lockdown was imposed, and he only returned in August.
She was not ready for marriage. She was lured from home and they took her away. I recorded a case with the police, but they never did anything until I was told later they had seen her at a health center, and then until today when you came back with her.
We prodded the father a little more.
But what can such a young girl do for you? They just need to abort so that she can go back to school. Otherwise, her future is ruined.
As we were departing, the family turned hostile towards the girl. Like an outcast, she was expelled and told to leave her home. We drove her to an area near Namisindwa district where she is married. Here, they acknowledged it was their son who impregnated her, are willing to take care of her, and are willing to speak to her family. However, they only made these comments off cuff. After talking to both sides, it became apparent that the girl's family was not interested in justice. They were bent on using the police report as leverage of negotiating with the boy's side. In the districts of Manafwa, Bududa, and Mbale, we found compelling evidence to show that this is the norm, and owing to this primordial culture, thousands of girls get pregnant every year and drop out of schools. And with the Imbalu season, which is an annual event calendar, both girls and boys of all ages mix freely, traveling across villages. Usually, it doesn't end well. An analysis of the statistics of all health centers in Manafwa shows that between January and mid-September, some 3,619 girls between the ages of 15 and 19 had gotten pregnant and sought antenatal care. But Gideon Wamasebu, the district health officer, called for caution.
According to the few we talked to, there's an element of poverty. And this I could call it individual poverty. Somebody stays around and is hungry the whole day, and there is a promise of a chapati. And at the time you are eating a chapati, you don't know the consequences of that chapati.
Bugobero Health Center 4 alone recorded 939 teenage girls between the ages of 10 and 19 seeking antenatal care.
The young mother who is stigmatized is unlikely going to come to antenatal care. And the only time you will see that mother is when the TB has failed to conduct a delivery and comes in as an emergency. Two things will happen. May come in And the end result may be a dead child or a mother who has suffered trauma, who has been traumatized.
After milling around the facility, we also noticed that while antenatal queues had females of all ages, postnatal waiting lines had many elderly women, ostensibly grandmothers, as young girls dump their babies and move on.
You end up having neonates who are prematures, but the worst of it is for those who can't carry them to that level. So like when you reach a health facility, you can be interested in the abortion rate during this period. And particularly around this time, unfortunately, they don't record it as abortion. Should be miscarriage, should be premature delivery.
The UN's Children Fund defines teenage pregnancy as a teenage girl, as usually within the age brackets of 13 and 19, becoming pregnant, and refers to girls who have not reached legal adulthood, which is 18 in Uganda. The 2016 Demographic and Health Survey details that 1 in 4 adolescent girls aged 15 and 19 years was either pregnant or already had a child. Separately, in a national study of adolescent health risk survey in Uganda by the Ministry of Health, almost 22% of adolescents reported some form of sexual activity. And for more than a decade, Uganda has had the teenage pregnancy rates of about 25%, which, although lower than the sub-Saharan Africa average of 31%, the country is still faced with a crisis of epic proportions. The reality of the almost 100,000 teenage pregnancies a year demonstrates that this country's social and economic systems have failed a substantial proportion of our young citizens, and in doing so, they're helping to perpetrate and enlarge the number of poor and badly educated young men and women.
The fact that we have a huge population of young people who are depending on the few that are working to be able to thrive, to be able to survive. And therefore, the few that are working find it very difficult to make any savings or to make any investments which are required for country to attain development. But why is this happening? One of the things that we continuously see is our fertility is high.
COVID has demonstrated to us as a society that the young people that we are dealing with are actually very active sexually. And what this means is that if we are to take on any interventions, they have to be comprehensive interventions. Interventions that are not just targeting the very moral kids, but also targeting the kids that one would ideally define as getting into spaces that they can't be getting, they shouldn't be getting into. Now, part of the challenge is that we still, in terms of making our policies, approach it the other way, that thinks that kids are not supposed to be doing some things before they reach a certain age. And this is not true.
Analysis of available district health data indicates Dorolo, Kaberamaido, Amolata, Zombo, Ngora, Budaka, Manafwa, Kwania, Apach and Pakwach recorded the highest teenage pregnancy rates during the COVID-19 lockdown. And a further analysis of the data of all 146 districts by Crane Analytics based on spike between the first 2 quarters of 2020, even then the data merely offers a snapshot of the extent of the problem. Other districts with high numbers include Kaliro, Bukwo, Katakwi, Kapelebyong, Bugweri, Bulisa, Gomba, Kamuli, Amuria, Kole, Serere, Aleptong, Sironko, Bunyangabu, Namutumba, Napak, Maracha, Bulambuli, Buvuma and Luengo. The Director for Family Health at the National Population Council, Betty Chadondo, told NTV that the country's development aspirations will remain a far cry unless government takes practical solutions to end early pregnancies.
Everyone has a role to play. This girl child has a role to play. So giving them as much information that will help them to take and think about their bodies without being abused is very pertinent. So sexuality education is important. The framework is in place, but I think we have different opinions, different perceptions on it, given our different backgrounds.
She said the high frequency of teenage pregnancy also explains the high school dropout, which propels girls into early marriages, hence the vicious poverty cycle.
If you look at the statistics of this country in terms of enrollment in school, but also transitioning to different levels of education, we continuously see the girl child is jeopardized. Because from primary to secondary, the transition rate for girls is lower than transition rate for boys.
In Paida town, the main urban center in Zombo district at the border with DR Congo, the sight of young pregnant girls is conspicuous. Boys of school-going age are going around with their business ostensibly due to the school closure. The district community officer, Sam Akachi, told NTV that the country appears to be resigned to fate in the fight against early pregnancies.
I am not very rigid to say don't use for family planning for the girls, for the adolescents, for the teenagers. Because even if we say don't use, but the trend is telling us that many of them are getting pregnant. So if the family planning has become a remedy, because if parents fail on their roles to really impart morals into their children, then the family planning could become a remedy. To really become a remedy, particularly in this situation where the statistics are going higher. Of course, I know I am a believer myself in God. I'm a Catholic. And my religion teaches us that all sorts of family planning, particularly artificial ones, are wrong, are sinful, they are immoral. But my argument has always been that why is it that our church is also failing to impart these morals into these children and girls and parents, not to get pregnant?
Unlike in the central region, where exposure to literature is said to be a contributing factor, Akachi said Zombo is different.
What is applying in our situation is that most parents have no time to talk to their parents about sexuality. Children go on to find these things by themselves, on their own, through their peers and ABCD, which in my view is dangerous.
Analysis of data of the 18 health facilities in Zombo district shows that the district recorded 2,186 teenage pregnancies between January and July. We encountered many girls attending antenatal and postnatal care. Paida town, the main urban center, had the highest number of 512 teenage girls pregnant. Dr. Jami Omara, the medical superintendent at the Catholic-run Nyapea Hospital, told NTV that the expectant teen mothers are full of challenges.
Because they are not yet ready, they are prone to poor outcomes. When we are looking at obstructed labor, they form quite a proportion. You are looking at mothers who lose their babies. They also form quite a good number. If you go to the children's ward, for example, the children to these teenage mothers are always have a higher chances of falling sick and dying.
Dr. Omara said the problem is worsened by lack of a coherent policy to deal with the problem.
So at a national level, I believe that we need a policy to be put in place that provides for 1, sensitization, 2, the prevention, and then encouraging them to access all forms of care that they would need. And key in that package would be sexual and reproductive health services.
The district health officer, Mark Bramali, said out of every 10 deliveries at health centers, at least 7 are by females below the age of 20, and this has been the trend for the last 2 years.
Sometimes we have seen these teenagers getting pregnant, and when they reach the hospitals, the ages are elevated by the parents. Why? Because at home, they will have already initiated negotiation with the perpetrator, and something might have been paid, and these things go unreported.
Bramali said it is high time the conversation started on discussing sex education with teenagers.
You can say we are going to expose her to these pills, and it's like we are now encouraging them to go and have sex. But the truth of the matter is that in one way or the other, they still go and get exposed. It is better now to have them talk to, they are counseled, and have those things as a protective measures, other than just ignoring and saying, no, this is going to, culturally it is not allowed, morally it is not accepted, but I think these things are happening.
Across the globe, the World Health Organization says every year, an estimated 21 million girls aged 15 and 19 years in developing regions become pregnant, and approximately 12 million of them give birth. At least 777,000 births occur to adolescent girls younger than 15 years in developing countries. The executive director of the NGO, Center for Health, Human Rights and Development, which advocates for the right to health, Moses Mulumba, told NTV it is high time we brought back the discussion on sex education in schools.
One would have expected that actually, because parents are responsible for their kids, they take better responsibility for the kids. This is not the case. What does it mean? It therefore means that in thinking about policy, in thinking about interventions, we have to be much more comprehensive than ever before. When we are classifying sexual reproductive health and rights in our first policies in the early 1990s, we actually had a comprehensive approach. The same way we had with HIV. You give options, and if sexual activity is going to be happening, then you provide sufficient information.
Mulumba said some of the existing laws are long overdue for amendment, while government remains undecided on targeted policies like the National School Health Policy and the National Sexuality Education Framework.
We have not got into a space of actually ensuring that the policies that we are making are progressive. Many of the policies that we made before then were very helpful because they encouraged information. They encouraged, making sure that these kids can be able to access the professionals that they need to help them deal with the conditions. This is not the case today. We have policies that have come of age, which are up for review. These policies are not being reviewed. And because it's an issue that intersects with sectors, sometimes people don't know who to blame. It is a health issue, it is an education issue, it is a gender issue, it is a social issue. But every one of them is not sure who is supposed to be doing what.
In 2018, the Ministry of Education formulated the National Sexuality Education Framework, which seeks to create an overarching national direction for sexuality education in the formal education setting, but it was panned by some stakeholders, especially the church.
We keep questioning ourselves much more than actually putting these policies in place. Even the policies that we have made are in a school environment. We have not made policies that are actually looking at these young children in the parents' arms. I think the sector needs to move, including the geographical coverage, not just in schools, but also thinking about how the children's environment is working out.
Both the Anglican and Catholic churches told NTV that they acknowledge the crisis at hand, but it should not be used as a pretext to compromise our cultures.
And we raised concern to government. We said, look, these are the things we're not comfortable with, and we cannot accept them to be implemented in our schools if left in its current form. And we also gave our proposals that let it be done this way. The church itself is not opposed to sexuality education. It promotes it, but it promotes what is appropriate to a particular age bracket, and the content that is packaged to the children must be something that promotes the values of the church.
What is wrong is not wrong only in Uganda. It is wrong in Africa, it is wrong in America, it's wrong in all Europe or whatever. So then, I do not believe that parents in England buy their children condoms. I've been to many of these continents. I don't see parents buying contraceptives to their children and say, here, take to school and go with them. No, why are we? They are not even available. There are schools, by the way. You do not go to schools in Europe and find the contraceptives on the schools being given out as pencils or pens. So why are we saying these things? So for me, I don't believe that we should advocate for those things. We have a culture, and good enough, our culture still has... Don't we have cultures? Have we gone away from our cultures? Have we gone away from our Christian values? These are values we need to stand for as a church. Young people, you are out there, you have a life ahead of you. You have a future. Secure your future. Work at it. You can achieve those things. What is happening in this country that we are letting our young people do what they want, and it ends them in problems.
So, what are some of the practical solutions to this crisis?
I would want that this government and our stakeholders and our NGOs who are pushing for this to also push money where it is necessary. Young people don't have information. Young people don't know what is right. They are out there going and everyone saying it's okay, you can do it. And we're saying as church, yes, contraceptives are okay for people who have families. But if you get young people in secondary schools, our daughters and sons, really you don't want to believe, then it is if the parents agree with that, the parents should go to shops or whatever and buy those things and give them to children. Why would the government start giving them to our children who have not? So for me, I believe if it is something the parents agree with, then they're the ones who buy them. The parent can say, me, I want my daughter to have condoms. She goes and buys them, or my son, and takes them to the teacher. But we believe that parents have a moral responsibility to their children.
What I see, there's need for us to enter into a fraternal dialogue. We need to dialogue with the kids, we need to dialogue with the parents, to dialogue with the political leadership and the cultural leadership. You see, raising a child we don't need to look at only one aspect. At times I see that families need to be educated. We need to start re-educating families, get programs that we try to let parents know their responsibilities.
I don't know which scientific papers or scientific studies have actually been conducted to demonstrate that if you talk about sex and provide information about sex, people are going to increase to having sex. When we have talked about condoms and availability of condoms, studies have actually demonstrated that the HIV/AIDS infections have gone down. They have also demonstrated that, controlling pregnancy happens. They have never showed the negative results, and I will be so happy to look at results which are actually showing scientific results that are demonstrating that when you normalize the talk about condoms, you're going to actually increase the rate at which sex is being had. I think this is all the traditional and half-baked kind of information that is flying around.
Various African governments have adopted ambitious goals to end child marriage, introduce comprehensive sexuality and reproductive health education, and address the high rates of teenage pregnancy across the continent that negatively affect girls' education. Uganda too committed, but remains undecided. During the marking of the World Teachers' Day last month, President Museveni weighed in on the matter.
1 million have died in 7 months, not 2 years or a year. No, just from December when it started up to now, it's like 9 months. So it's a very big crisis. It's not a joke. So when you are talking, oh, the children got pregnant there. Okay, if they got pregnant, at least they are alive. Don't talk like children, please. Oh, they got pregnancy. What? Fine. Pregnancy doesn't kill, it causes some problems, but it's not the same thing as dying.
At the commemoration of the 25th anniversary of the International Conference on Population and Development last year in Nairobi, Uganda committed to reducing the rate of teenage pregnancies from 25% to approximately 13% by 2020, reduce unmet family planning needs from 28% to 10% by 2022, as well as ensure operationalization of the national sexuality education frameworks. With the fallout from the COVID-19 pandemic and the extent of the crisis at hand, it will take more than just commitments.